So welcome everyone to our webinar tonight featuring the technology experience with coronavirus, the case of Taiwan. My name is JP Offred. I'm the president of the International Academy of CIO, the host tonight. As background, the International Academy of CIO was founded in 2006 and is headquartered in Tokyo, Japan, at Waseda University, with a secretariat in Bangkok, Thailand. The focus of the IAC is on fostering the development of CIO and IT executive leadership programs, including master's programs at universities around the world, facilitating the development of IT leadership and CIO policies and institution building, including for CIO councils for national governments and local governments, and also applying technology to areas of current need, emerging technologies to areas of current need, including aging society and prevention and responding to natural disasters. A couple of housekeeping notes. Our guests tonight, our guests tonight are Ming-Feng Shuang, Associate Director from the National Development Council of Taiwan. Thank you, Ming-Feng.
Thank you.
Ken Wang, also from the National Development Council. Thank you, Ken.
Thank you.
Calvin Liao, Deputy Director of the Taiwan E-Government Research Center in Taipei, Taiwan. Ken, Calvin, and Ming-Feng kindly hosted the International Academy of CIO's annual conference this last September. Some of our initiatives include publishing the annual Waseda IAC Digital Government Rankings, now coming up on its 15th year, hosting the annual International Academy of CIO conference, also its 15th year, crediting CIO master's programs around the world. I have an iOS book series with iOS Press, and also the Journal of CIO and Digital Innovation. So with that, one additional note, we'll have a Q&A panel on the right-hand side. If you have any questions, please type them in, and Ken, Calvin, and Ming-Feng will answer them at the conclusion of their talk. I'd like to thank everyone for joining and welcome. And with that, I'll turn the microphone over to Ken, Ming-Feng, and Calvin. So thank you all.
Thank you.
Okay, thank you, Professor, and dear IAC colleagues. Let's switch the screen. Yes, is it okay?
Yes.
Okay, dear IAC colleagues and all friends from the world, it's our pleasure to have this opportunity to share our experience in response to COVID-19. As you know, Taiwan is now still in a very early stage of this pandemic. Our confirmed cases are 440 and the death toll is 7. And until yesterday, we have no new confirmed cases for 11 consecutive days. Therefore, we still focus on how to prevent the spread of the virus. The related mechanism may be worthy of reference for you to prevent a second or third wave spreading, or even to prepare for the next crisis in the future. However, we also worry about our lack of experience in large-scale outbreak and not enough relative preparedness. Therefore, we appreciate any suggestions for us to deal with those kinds of outbreak situations. Thank you. And this is the agenda we would like to share for today. First, I would like to highlight some key factors that help Taiwan to prevent the spread of COVID-19. And secondly, I will in detail to introduce some systems and the mechanisms we established using ICTs. Third one is some news and daily life so far in Taiwan. And the last one is some challenges and opportunities that concern us. Regarding the first topic about the key factors to prevent the spread of COVID-19, those factors could be classified into 3 parts, which are proactive response, collective intelligence, and effective notifications. As to the proactive response, first, we were already well prepared for epidemic. In 2004, after the SARS outbreak, the Taiwan government established the National Health Command Center, or NHCC. This center is part of Disaster Management Center that focuses on large outbreak response and acts as the operational command point for direct communication among central, regional, and local authorities. The NHCC unified a central command system that includes the Central Academic Command Center, the Biological Pathogen Disaster Command Center, the Counter-Bioterrorism Command Center, and the Central Medical Emergency Operations Center. By unifying those centers, the NHCC keeps alert and prepared for the next crisis. Secondly, government officials quick response to suspicious events. On December 31st, 2019, a CDC official read an article from Internet forum and sensed that a cluster infection of atypical pneumonia may be broken out in Wuhan. He soon reported it to his colleagues. After assessment by CDC, Taiwan officials announced and began to board plane and access passengers on direct flight from Wuhan for fever and pneumonia in the same day. That was a very important reason why Taiwan can successfully fight the epidemic from the very beginning. Third, the protection measures have escalated due to the situation continues getting worse. On January 5th, the notification was expanded to include any individual who had traveled to Wuhan in the past 14 days and had a fever or symptoms at the point of entry. And later on January 15th, the pneumonia was officially listed as the notifiable communicable disease in Taiwan. Then on January 20th, the Central Epidemic Command Center was activated, led by the Ministry of Health and Welfare. CCC consists of the Expert Advisory Group, Community Epidemic Prevention Group, Border Epidemic Prevention Group, Information Integration Group, and so on. Therefore, it overall plan and control epidemic prevention. Due to the advanced preparation and the improvement of protection measures according to the situation, when the first confirmed case entered Taiwan from Wuhan on January 21st, we were already prepared to fight it. As to the collective intelligence, you may know that COVID-19 occurs just before the Lunar New Year's holiday in Taiwan, which was from January 23rd to 29th. During that time period, millions of Chinese and Taiwanese were expected to travel for the holidays. So government had to quickly mobilize and institute special approaches for case identification, containment, and resource allocation to protect the public health. Those relies on the effect cross-agency collaboration and public-private collaboration to complete the job. Regarding the cross-agency collaboration, there are two important systems were soon implemented. First was epidemic prevention platform, which contained the related data of isolated or quarantined people. It was linked to our existing national health insurance system to help the doctor alert the patients when the patients go to the clinic. It also links to the M-Police system to help police alert people when those police were conducting the inspections. Second one is e-fence system. It will detect the smartphone signal to check if the isolated or quarantined people still stay at home. These two systems means to contain the spread of the coronavirus with effective way and meet the minimum requirement and the proportionality principle. I will explain the detailed scenario later in the slides. Regarding the public-private collaborations, first was the e-mask ordering system, which based on the medical mask rationing mechanism and combine the POS system of pharmacies, the kiosk in the convenience stores, and the logistic functions to help people purchase masks at the pharmacy or online or at the convenience stores. This kind of purchasing methods help people buy masks easily, no matter they can use online service or not. It is also very suitable for the elder people. Next one is the apps of mask map. Government open the data on mask allocation, real-time sales quantities, and the location of pharmacies. The civil society use those open data to create the online map. People can check the map to know which neighboring pharmacies still have masks to selling. This map can also show people that the mask rationing mechanism is fair to everyone to avoid causing public suspicion or panic. I will also explain the detailed scenario later. Next one is the effective notification. When crisis occurs, like a pandemic this time, one of the most important things to keep people calm and trust that government can handle it. In order to earn the trust, government should make information as transparent as possible. Of course, if it is related to the privacy and the information disclosure is not helpful for epidemic prevention, then the information doesn't have to be disclosed. But for the rest of the information, they should be transparent. Here we have three main mechanisms to keep information transparent and to improve the effectiveness of notification. First is the daily press conference, which is held by NHCC. In the press conference, the minister announced the increasing number of COVID-19 confirmed cases and the related information, along with the new mechanism or restrictions for epidemic prevention. And we have established a free 1922 hotline to facilitate the public to inform the epidemic situation and get consultation. In fact, CDC also creates an official Line Messenger account that provides people with access to disease information. Line Messenger is a freeware app for instant communication, just like the WhatsApp. This is very popular in Taiwan. Second part is to against the disinformation and to publish the correct ones. The idea here is to defeat rumor with humor. We think the reason why netizens like to forward fake news is that fake news is shocking and the timing of those fake news come out is good. If the government wants netizens to be willing to forward the classified messages instead of the fake news, then the classified messages must be more attractive and funny enough so that people can remember and be willing to report. In addition to publish correct message online, the government also produce 1 minute promotional video, which is broadcast every hour on TV. Every day, different experts introduce the knowledge of epidemic prevention in the video, such as how to wash hands, where should we wear masks, and so on. Next one is to use cell broadcasts to alert people. If government sense that some hotspots, such as temples, night markets, and the resorts are too crowded, then they will ask the telecom company to broadcast the alert message to the nearby people's mobile phone to ask them not to stay at the crowded area. On the other hand, the other kind of situation is that if in a specific time period, some people will stay at the same area with the person who was later been diagnosed as COVID-19 confirmed case, then the NHCC will require the telecom companies to broadcast the alert message to those people to ask them take special care over their own health for 14 days. Now I would like to introduce some mechanisms and systems using ICTs. First one is to assist the doctors to recognize the isolated or quarantined patients. The approach is to link the Epidemic Prevention Platform, EPP, with the National Health Insurance System, NHIS. In this way, the doctor can prevent themselves from contact with the isolated or quarantined patients. The whole system and the mechanism were created within a 3-day period. Please look at the diagram below. From the left-hand side to the right, if some people come to Taiwan from abroad, while on the plane, they could scan a QR code to online report a travel history and health symptoms to classify their infections risk based on the flight origin and the travel history in the past 14 days. People with low risk will send a health declaration border pass via SMS messenger to their phones for faster immigration clearance. Those with higher risk were asked to quarantine at home, and their name, ID number, and the smartphone number will be collected into the epidemic prevention platform. On the other hand, if some people have ever closely contact with a COVID-19 confirmed case, such as living or dining together, then they were asked to isolate at home, and also their name, ID number, and the smartphone number will be collected into the same epidemic prevention platform. If it's quarantine, then the township official will regularly check their health until the end of quarantine. If it's isolation, then the medical staff will test them for 3 to 4 times to check if they were infected until the end of isolation, because they have a higher probability of being infected. EPP links to the National Health Insurance System, so that when the isolated or quarantined people go to see a doctor or go to pharmacy to buy masks or medicines, the medical staff can check the insurance system and know that they should be in quarantine or isolation at home right now. Therefore, the medical staff can take the protective measures such as ask the patients to go home, report to police, or disinfect the environment of the clinic or pharmacies. The reason why we can use National Health Insurance System as the fundamental system for epidemic prevention is that there are 99.9% of people are covered by National Health Insurance in Taiwan. That includes residents such as adults, children, baby, and foreign spouse, immigrant workers, etc. And the personal premium rate is only 1.4%. With reference to the personal income level, it means most of the people only need to pay 400 to 800 NT dollars per month for the health insurance. So people enjoy having this insurance, and almost every pharmacy, public health center, clinic, hospital, home health care, etc. join this system. The wide coverage of people and the medical institutions are the reason that NHS is suitable to be the fundamental system for epidemic prevention. In this diagram, you can see, in this diagram, you can see that National Health Insurance Administration issue the insurance card to people. People go to seek the medical treatment with this card, and the treatment information will send back to the National Health Insurance Administration for reimbursement. Now, for the epidemic prevention, government links the newly established epidemic prevention platform to the NHS so that the insurance ID could link to the isolation or quarantine ID. Therefore, when the insurance go to seek the medical treatment, the medical staff will know where the patients should be in quarantine or isolation right now. The second mechanism is to assist the police to recognize the isolated or quarantined people. The approach is to link the EPP with the M-Police system. In this way, the police can recognize and take the isolated or quarantined people back home. As the diagram shows, M-Police system is to help police identify people when conducting inspections on the streets. Government link EPP to the M-Police system. Therefore, when isolated people is outdoor and be inspected by a police, the police will know the person will be in quarantine or isolation at home right now. Thus, the people can take the protective measures, send back the person, and fine him or her 10,000 to 1 million NT dollars, depending on how many times he or she have been caught outside. The third mechanism is to use e-fence system to detect whether the isolated or quarantined person remains at home. First of all, Taiwan has a Personal Data Protection Act, which is regulate the collection, processing, and the use of personal data, so as to prevent harm from personality rights, and to facilitate the proper use of personal data. Therefore, the government is not allowed to improperly collect and use personal data. However, for epidemic control, there is another Communicable Disease Control Act, which regulates the competent authorities may order persons who have been in contact with patients affected by communicable disease or who was suspected of being infected by to move to the designated place or require measures such as examination, medication control of central disease area or isolation. According to the previous two acts, government set up the e-fence system, which in line with the principle of minimum requirements and the proportionality. That means only the mobile phone number of those quarantined or isolated people will be kept in this e-fence system. And only the mobile phone signals, not the GPS data, will be detected by the telecom companies. This scenario is as shown in the diagram. EPP platform provides the top 5 telecom companies with the mobile phone number. Then the base station of the telecom company frequently detect where the mobile phone signal is shifting to a different base station, or the signal is becoming stronger or weaker. In this way, combined with spatial algorithm to determine if the person has left their house. If so, the telecom company will simultaneously send 2 messages. One is to send to a person and ask him or her to go back home right now. And the other one is to send to the nearly police to take the person back home. The fourth mechanism is to hold a daily press conference to against disinformation and build a sense of safety for the public. As you can see, the government informed and answered questions from press about the latest epidemic information and the epidemic prevention measures through TV and other media at 2 p.m. every day, including holidays. It also announced the new mechanisms or restrictions of epidemic prevention. Since the NHCC consists of expert advisory group, community epidemic prevention group, border epidemic prevention group, and the information integration group, such leaders of the groups would announce or explain their specific topic if needed. In this way, CCC against false information and gain trust from people. The fifth mechanism is to use humor over rumor. These two humorous promotional graphics use the cute image of our premier as the main characters. The one on the left-hand side is to tell people the ration of medical mask is 9 pieces for adults and 10 pieces for children every 2 weeks. The right-hand side is to tell people that Taiwan has sufficient tissue paper and other food supplies. It's not like the premier's usual serious facial expression. Those two graphics are very cute. That's why the netizens were waiting to repost them instead of the fake news. And the people would have deeper impression than that of fake information. The sixth mechanism is to use cellular broadcasting. Government cooperate with top 5 telecom companies to broadcast the message and the alert under 2 circumstances. First is to broadcast the pandemic prevention and social distancing information to the mobile phone around the crowd hotspots, such as night market, temples, resorts. The left-hand side is a scenario diagram. The one in the right-hand side is to notify the people who had ever in the same area with the COVID-19 confirmed cases to take special care over their own health for 14 days. In chronological order, the base station received the mobile signal from many people at a specific time and place. Later, one of them was diagnosed as COVID-19 confirmed case. Then the CCC required the telecom company to broadcast the alert message to everyone else and ask them to take special care. The seventh mechanism is to create the e-mask ordering system along with some other related mechanisms. As to the e-mask ordering system, there are 3 versions. The first version is to sell masks at pharmacies. The purpose of this system is to prevent mask producers and sellers from holding masks by means of requisition. In addition, it also ensures that everyone can successfully buy masks by means of rationing and affordability. In terms of requisition, the government requisitions all medical masks produced domestically since January 31st. Later on February 6th, government launched the first version e-mask ordering system. We also set up 92 new mask production lines in 3 months to meet the large demands from people. The daily production increased from 1.8 million to 16 million right now. As to the rationing, the government controls the sales of the medical masks. We combine the e-mask ordering system and the national health insurance system to achieve the rationing. As I mentioned before, that NHIS has a wide coverage of people and the medical institutions in Taiwan. So we also use it as the fundamental system for rationing. Next one is the affordability. Government control the price, and everyone can buy masks with price of 5 NT dollars a piece. Everyone should be able to afford this price. There is a very important application to support the first version of e-mask ordering system. That is a mask map app. Actually, there's not only one map, but many maps available online. Civil society uses the government open data on the number of the mask allocation to the pharmacies, the real-time mask sale quantities, and the location of pharmacies to create many kinds of mask map apps. People can choose any map to check the number of masks remaining at all sales points. Those open data comes from the mask rationing system and are updated every 3 minutes. On the other hand, for those people who don't use a computer or smartphone, they can still find and buy masks at a pharmacy with the health insurance logo in the front door. As I mentioned, that almost all pharmacies cooperate with the Health Insurance Administration. This is the scenario of the mask creation using open data. The open data of mask allocation, amount of sort, and the location of pharmacies are used by civil society through open API. And the people can refer to the maps to buy the mask at the nearby pharmacy. This one is the maps on web. The red triangle means the masks are all sold out. Yellow triangle means either the adults or children's masks are sold out. Green triangle means both the adults or children's masks are not sold out. Click any triangle will pop up the detailed information. This one is the map app. Same functions as the one on the web, but with navigation. The second version of e-mask ordering system is for selling masks on web or on mobile devices. And the masks will be delivered to buyers' designated convenience store with only $7 NT shipping fees. The purpose of this version is to allow people who don't have time to line up at pharmacy could pre-order and purchase masks online. In this way, people can save about 1 hour of waiting time. They can buy masks online at any time and pick them up also at any time after a week, because the convenience store in Taiwan is open for 24 hours every day. This is almost the first time the government's nationwide online service has been combined with the offline logistics of the private sector. Anyone with a national health insurance card or citizen digital certificate is able to pre-order masks using a computer or a mobile devices. This version was launched on March 12th. And the third version of e-mask ordering system is for selling masks at the kiosk in convenience store. The purpose of this version is to serve the people who don't have time to line up at the pharmacy and don't want to purchase online. It enhances the public-private collaboration to assist the people who don't use technology, especially for the elder people. Let's see the video in which the clerk of the convenience stores demonstrates how to buy the mask. The process takes only about 1 minute. And the card he holds is the health insurance card. Let's see the video. I'm sorry, it's only Mandarin. You can see he sits in the car, in the kiosk. And press the button filing the
然后进去
examine.
了之后，口罩预购按一下。
Yeah,
按完了
pre-order.
之后呢，这里先同意，然后同意完之后，这里有一个确认，确认键按一下，它会跑，跑完之后呢，那个手机
And
电
if
话
you have ever ordered before, then you will keep some information.
如果没有的话，像各位第一次领取的话，就要直接自己打手机电话，打完之后确认按一下。
And when you pre-order,
然后这里
you can pay online or you can print it out and pay on the clerk.
把单子印出来呢，小编记得收起来，然后拿到柜台，
So right now, he just print out and to pay on the clerk.
然后给柜台人员示范。刷取3段式条码之后，他会跟你收钱，然后总共会收52元，然后把钱拿给那个店员，
So you pay,
然后52元，这样就完成结账的手续。
then everything's done, and you can pick them up one week later. And after 1 week later, you can pre-order the next time. Okay, and next part is some news and the daily life so far in Taiwan. This is a COVID-19 pandemic development map in Taiwan. That's directly linked to the website to check up the data situation. As you can see, that's from March 18 to April about 10, there's increasing. But after then, it seems very straight in the situation, and we have no more increased cases in past 11 days. The new special issue of Time magazine, which called Finding Hopes, the Taiwan-100 community of navigating our new reality, invite President Tsai to share the experience and provide solution to the pandemic. She expressed that although Taiwan has a disadvantaged position in the international stage, it has excellent capacity in production, medicine, and technology, and can still make a contribution to the world. These are the talking points of the President Tsai regarding to ICTs, including cross-domain collaboration, using technologies, civil mobilization, mask rationing, and e-mask ordering systems. There are also other magazines and media that appreciate Taiwan's experience, such as the Germany magazines, Forbes, and CNN. And these are some photos I took recently. We are not locked down, but were asked to keep social distancing indoor and outdoors. This is the cafeteria inside IKEA. As you can see, everyone wore a mask while queuing. Actually, almost everyone in Taiwan has the good habit of wearing masks as needed. Some experts said that this must be one of the important factors for Taiwan to avoid the spread of COVID-19. As to the photos below, people all keep distance while eating unless they are the same families. These are the photos taken in the train station, on the train, and on the street. Everyone has to wear mask and pass a temperature sensor when entering the train station. It's difficult to keep the distance on train, but everyone wears a mask and almost no one speaks. In this way, we protect ourselves and others. The bottom left photo shows that there are still many scooters and cars in rush hour. Similar protective measures in office. Everyone have to wear mask and pass the temperature sensor when entering the building. Not allowed to speak in the elevator and wear mask when attending a meeting. For the people in quarantine or isolation, the city government will send them, in addition to the food supply, city government will send them the package which generally includes masks, dry foods, and the serial number for 14-day free video streaming service. As to me, I think the free video streaming services is the most important. People will feel less bored because they can binge watching the program for consecutive 14 days. The next topic is challenges and opportunities. Having experienced this pandemic drives us to think about some core competency that CIOs should consider, such as resilience and smart government, predictive data governance, and the collaborative environment. First item is to build a smart work environment. It means to apply information and communication technologies to create a working environment that integrates people and the environment, and to achieve energy saving, smart interaction, and user-centric workplace. Facing the improvement of the safety operations standard in the area of risk, the remote management and the remote operation of government administration and the normal or backup mechanism must be established to enhance government overall operational resilience. Second one is to promote omni-channel services, combining the official website of the government agencies, social medias, and other existing citizens contact points, and in line with the spirit of the omni-channel, to enhance content of the official website and to integrate all the contact points online and offline channels so that people can obtain an uninterrupted services experience. Furthermore, in accordance with the response of the social media, to improve the quality, experience, and the trust level of all-in-one services. Third one is to ensure remote digital trust. It means to adopt the innovative model and the proof of concept steps to construct a government service process without any possible leakage of personal information, which may cause people suspicions, thus to earn people's digital trust. Fourth one is to establish a predictive data system. It means to set up a forward-looking and cross-ministry data governance group to conduct big data analysis for future change in politics, economics, industry, and society. In this way, to immediate response to important national and cross-regional issues effectively. Fifth one is to accelerate data circulation and streaming. It means to establish data lifecycle assessment for personal and non-personal data, conduct risk management of data exchange mechanism and personal data protection over cross-organizational units and even the private sectors, in line with the data security regulation to establish a flexible data transmission framework. 6. Improve evidence-based decision for transition. As everyone around the world is facing the impact of COVID-19 spread, CIO can conduct the use of scientific data and co-hack with other countries to suggest transitional measures that balance the economic with the protection of the public health in order to help policymakers making more informed decisions, especially when it comes to lift coronavirus restrictions from lockdown for the public such as back to school day, proper school distance, and as well as reopen public facilities and the business. 7. Amend the regulation that taken into account national security and privacy. CIO have to harmonize Personal Data Protection Act and other regulations related to the national safety protection, such as Communicable Disease Control Act. Make it more clear that under what circumstances government can collect, process, and use what kind of personal data, or even to deliver those personal data to third party for disaster prevention. Only in this way can we build mutual trust between the government and the people, and we'll prepare for the next crisis. Last but not least, enhance the quality of the wisdom of people's participation. In line with the information security, use AI technology to improve citizens' ability to common data usage, public and private collaboration, and hackathons, thus to solve the problem of asymmetry of information and profession when people participate in public affairs. In this way, we can improve the effectiveness of citizen participation. Thank you for listening, and we appreciate any suggestion and question. Thank you.
Thank you very much, Ken, for your very informative presentation. Well, we have a number of questions from the attendees and audience. One of the first questions was in regard to the EPP app, as to how the Government and National Development Council went about developing it or having it developed, and then to what extent it's proprietary or open source.
Okay, the map we create, actually the civil society creates the apps, and we cooperate with the other agencies to open those data. And those data, from the very beginning, we only open the data per day, every day. But people think that's not quick enough. So we shorten the time and become the 3 minutes. And also we open those data. We have an open data platform, and every civil society, they can see what open data available on this platform. But they can use the open API to direct links to the data and use those data in their maps.
Yeah, thank you, Ken. Another question is the balance with the public and the citizens and residents, how some might have a fear or a potential panic, and others might not take the pandemic as seriously. And so perhaps you can talk some more about communications to the public and the use of humor.
Okay, actually, I think in Taiwan, almost everyone very take serious about this pandemic from the very beginning, and they trust the government. So that's why we can prevent this spread of the COVID-19. So based on this trust, the government can promote the information and to ask everyone to follow some rules, maybe like to wear masks, like not to go to the crowded hotspot, and so on. And for this information, that's because some panic will be spread through the rumor. So we use the humor, like the graphic I used in the PowerPoint, and the other mechanism, many other mechanisms to do that, to use humor to attract the people to pay attention on the correct information. And also in Taiwan, we have Line Messenger is very popular. So in Line Messenger, we have an account that can publish the correct information, and also there's a call back account. If some people, they feel some information, they're not sure that information is correct or not, they can resend the whole information to that callback account, and that callback account with some AI mechanism, they can feedback that if the message is correct or not, based on all other people's suggestion, because maybe those messages already been notified that those messages are incorrect or disinformation, so that they can use the same the AI mechanism to detect this information, also kind of those fake information, so they can the account can just feedback, not the people to feedback. The account can automatically feedback this information is correct or not. So that's our mechanism to fight the disinformation or misinformation.
Thank you, Ken. And another question is, did Taiwan or is Taiwan doing anything special for the elderly since they're so at risk?
Yes, for elder people, I think mostly they don't use the computer or don't touch the technology. So we promote the information on television or on with other mechanisms that those elder people will in touch with that. And also for the mask purchasing I just mentioned, because those elder people they don't know how to use the apps or the application online to purchase the mask, and maybe they don't want to line up at the pharmacy because they are older. So they can go to the convenience store and just stick in the insurance card and to purchase them. They only take 1 minute or 2 minutes, so they can use those way. And also in those convenience store, the clerk in the convenience store are all very friendly. They can teach those elder people or even to help them to purchase the mask. So I think we use those mechanisms to help the elder people in this way.
Another question relates back to the humor initiative as to whether there's metrics that you've done for these last several months or previously as to how effective that type of communications is.
Sorry, could you repeat that again?
As to whether the government or National Development Council has done a survey or developed metrics as to how effective that the humor type communication campaigns are.
Okay. I think the other department have do the survey, but we don't have the information about the result of the survey right now. So maybe if someone else interested in it, then we can provide the survey data later.
Okay, thank you. Two more questions. One is whether everyone in the population or all the citizens are fairly cooperative with the guidance on the masks and the social distancing, and whether some might be a little bit less cooperative, especially with the summertime coming and vacations and wanting to be more outside.
对。
Actually, yes. In Taiwan, it's very humid and heat when it comes to the summer. But as our mechanism, actually, if someone is outside and there's no one else around you, then you don't need to wear a mask. But if you are indoors or you are closely to the other people, then you have to wear a mask. So you don't have to wear the mask all the time outside. You just wear the mask as needed. But
Okay.
actually, yes, it's very humid if you wear the mask all the time.
And then the last topic is whether what advice would you and National Development Council and Taiwan E-Governance Research Center or suggestions you have for other countries, but both with the pandemic today and then also in balancing the health considerations with economic considerations.
Research now.
Excuse me, Professor JP, could you repeat the question again?
What suggestions do you have for other countries from Taiwan's experience so far, and also thoughts that you might have on balancing public health with the economy as over the next 4 to 6 months?
Okay, balancing the economy. Well, I think it's the challenging issue right now of Taiwan, because we just passed through the hardest time to prevent the pandemic. But now we just switched to another situation that we try to reopen our economic activities. And at first, the government has prevented some assistance and to help the people who have no pay during this time. And the second, they try to open the transportation to the international. But still now, it just keep the domestic economic activity, not the international economic activities.
Yeah, and I think for the other countries, maybe they should balance the economy and the health protection. But every country has its own policies for that. Because many cultural things or many countries, maybe they emphasize the health protection. Some countries emphasize on the economy. So I think that's very depending to different countries' culture and the politics. But in Taiwan, actually, we are more focused on the health protection. So as you can see, even we didn't have so many common cases, we still confined the people's activities before. And right now, we just a little by little to lift the restrictions. And for the other country, I think you can consider the balance. Yeah.
Okay, thank you, Ken. A couple other questions just for background. Have you closed the K through 12 schools and the universities at all? And if so, when are you planning to open?
You mean our schools?
Yes.
Our schools are still open. Yeah, and for most of the business, they are also open, unless our rule is that if one school they come up with 2 confirmed cases, then the school should be shut down for 2 weeks. But so far, it only happened once. So every school is still open right now. Yeah.
Okay, thanks. Another background question: did the government provide any supplemental financial support to families?
Yes, we have the case to support the the family and some people or the enterprise.
Yeah, they can get $10 million.
Yeah, the loan, 10 million.
Low income,
No.
low income family, they
Yeah.
can get
10,000.
10,000.
10,000.
10,000.
Yeah, no, if no income, they can go. They can have a 10,000 NT dollars for living right now. And for some small business or some people, they originally they have a job, but right now they don't have the job. Then they can apply for some loans for this time period.
Okay. And one last one, whether the civil society developers or National Development Council might consider offering some of the apps as a software as a solution.
Yeah. I think that many other countries already contact us, not contact to the art department for some support, some apps, for example, the events or the other application, how to build those applications in very short times. If other countries have the need to do it, then we are happy to help them to build or to give the concept or give the experience for that.
Okay. Thank you. So with that, Ken, Ming Fen, and Calvin, if you'd be kind enough to make some closing remarks, that would be great.
Okay. Thank you, everyone. And actually, as I mentioned in the very beginning, that Taiwan is still in the very early stage of this pandemic. So actually, we also look forward to the other countries can share their experience later in this series of the webinar, and to teach us how to prevent or how to deal with the outbreak of this COVID-19. Because I think that we're not very prepared. We're prepared for the very large scale of the outbreak. And also, if people or large country think our experience is worthy to reference, and you need any further information from us, then you're welcome to email us, and we will very pleased to give the information you need. Thank you.
Thank you, Ken.
Yeah, I think from the NHCC side, I think it's very important to promote online services, because in the past time, the online service is not very popular. After the disease, I think we will deliver a omni-channel service. That's quite important. And the other point is, it's also important to amend the regulations to balance the public health and the personal protection.
Thank you, Ming Fen.
Thank you.
Okay. From the point of view of the civil society, I think the Taiwan civil society is a very important part to prevent the spread of COVID-19. Because during this time, the civil society has shown collaborative with the government and many private companies to keep, for example, to keep the information transparent, and to create many apps to help the people to get the correct information and get the right government information to the people. I think we are very glad that the civil society and all the people can collaborate with the government. Thank you.
Thank you, Calvin, and thank you very much, Ken, Calvin, and Ming Fen, for the fantastic presentation and insight into Taiwan's initiatives for combating the coronavirus and rebuilding the economy going forward. And thank you all for joining tonight. We're planning others throughout the summer of this country experience series, and looking forward to seeing you and having you join again in several weeks. So thank you very much for joining, and thank you, Calvin, Ming Fen, and Ken.